We can speak now to Olga Cherevko, who is a spokesperson for the Office of the Coordination of Humanitarian Affairs, known as OCHA. She joins us now from Amman. Thank you very much indeed for joining us, Olga. Just first of all, a basic question. I mean, what's the latest you can tell us about the current humanitarian situation in Gaza right now and how it's evolved since the ceasefire deal took effect in October?
Thanks so much for having me, Tom. I think there are several aspects about the evolution of the situation. In many ways, it remains very, very difficult for the people on the ground because, of course, they are still displaced. There are still not enough supplies entering, and the damage and the impact of the war is still very, very present. What we saw after the ceasefire came into effect is an opportunity. And we took this opportunity and made sure that we spared no effort to address the needs of the people on the ground. So what we have done is, of course, we have been scaling up our assistance on all levels to make sure that the key priorities are addressed because there was, of course, when the ceasefire first came into effect, everything was a priority because almost everyone was displaced. There was not enough food. There was difficulties with getting everything in, and a lot of these impediments remain, which is why the situation continues to be difficult. We've also had a very difficult winter. So there's been several rainstorms in November and in December, and that had washed away thousands of shelters. People have lost everything that they had once again and became displaced again. And there were all these shoreline communities as well that we had to go and assess and make sure that the most vulnerable people got the assistance that they needed to at least have some of the most basic shelter needs addressed.
Okay, so you've covered lots of points there, and I'm going to go into some of them in a bit more detail. But I mean, most striking is that, a ceasefire has been in place for, 3 months now, and yet people are still being killed and still being displaced in different parts of the Gaza Strip. And I'm just wondering, what is the humanitarian access situation and what is the overall security situation for people and humanitarian workers on the ground there?
So I think the ceasefire, again, offered these opportunities for us to access areas that we couldn't access before. And we are reaching places that were completely off limits for us during the wars, during the months before the ceasefire. And so this access and these opportunities have given us the chance to reestablish our presence, to reestablish services, to reopen and build new temporary learning spaces, for example, healthcare facilities, clinics, repair some of the hospitals, repair some of the water networks, and allowed us to reach the people better. But of course, we still have areas that remain challenging to access. We still, as you said, have strikes ongoing. We have exchanges of gunfire and various other impacts that are affecting both our operations and of course they are impacting civilians on the ground. So we still have quite a few challenges remaining. We still have also, because of the storms, because of the destruction and the war, the roads that we are now taking within Gaza, many of them are still destroyed. There's of course still tons and tons, thousands of tons of rubble remaining, which are also impacting our ability to move around and the limited number of roads that are still remaining operational.
Right, and a lot of people packed into dense situations. The camps are extremely crowded. And I want to pick up on what you were saying about the winter weather, and obviously we covered the flooding and the winter storms on this channel. And I'm just wondering, coupled with the hygiene situation, a lack of clean water, has that translated into an uptick in illnesses, diseases? What have you been seeing?
Yeah, I think this has been an issue all along, and of course we're seeing even more acute situation now because of it. Because I would say the water, sanitation, hygiene elements, as well as the lack of shelter, adequate shelter, and these materials. Are actually some of the things that we need the most to address the public health crises, the spread of disease, the risk of various waterborne diseases, and any type of diseases that spread when people live so closely together without adequate sanitation, without adequate access to water. And these are some of the challenges that we continue to face in this area, because a lot of the materials that we need, a lot of the spare parts, the equipment to rehabilitate networks, to repair, to remove rubble, to remove sanitation, or to remove solid waste. They're very difficult to get, and we have a very difficult time bringing this equipment and these spare parts into Gaza. So this is preventing us from addressing these issues at their core. So every time there's a new flood, every time there's a new rain, we face similar issues that then contribute to these public health crises and the spread of diseases and sanitation issues and all sorts of things.
Okay, and judging from what you said at the beginning, aid is getting through to Gaza, but clearly not in the quantity that would be deemed adequate. And I'm wondering why that is and what the main obstacles are to aid getting into the people that need it there in Gaza.
So a lot of it is still some of the same challenges that we had before the ceasefire. And these are these sort of bureaucratic administrative impediments that we face in bringing these items in. Again, it's not always about how many trucks or pallets of things enter. It's about the actual content of these pallets and these trucks. So we have, for example, on a positive note, we have been able to resume our distribution of food rations to meet 100% of people's caloric needs. We've been able to do this in this January, for the first time since in over 2 years. So this is a great thing. But then there are many other areas that are extremely lacking. And that area, one of these areas is shelter, for example. Wash is another area, water, sanitation, and hygiene. So we are not able to bring these materials because of the various impediments. So these are customs clearances, restrictions on NGOs to be able to bring their supplies. And again, these items that I mentioned that are considered dual use and things that are restricted for us to bring into Gaza.
Right, and I mean, humanitarian operations in Gaza are facing challenges as it is, but there are more challenges on the way, not least the fact that Israel has revoked the licenses of dozens of international NGOs. UNRWA faces a massive financial crisis and has laid off a lot of staff. I mean, how are these two events likely to impact the lives of civilians there in Gaza?
So we are, of course, very, very concerned about these developments, and it has been an issue for quite some time now. What concerns us the most is the fact that NGOs and, of course, UNRWA, they're an integral part of the response, and any further impact and restrictions on their ability to operate would hugely impact our response. Because in all reality, if we are being honest, we do not have, as the UN cannot. We do not have the capacity to basically step in and fill in for the gap that would be left if the NGOs were not able to operate. So if you look at virtually any area of the response, the healthcare, the water, sanitation, the education, the protection services, NGOs are contributing a massive portion of this response. And so as the UN, we just simply would not be able to compensate for that gap. So it's a really serious issue. And of course, it would have a massive impact on the ground, which already the situation is not great to begin with. And we do not want to see it further deteriorate.
Okay, and just lastly, Olga, I mean, are there any messages you'd want to convey to governments or to donors who might be watching, in terms of what needs to be done there in Gaza?
Well, I think the message, our message remains the same, and that is that we want to have the access, the unimpeded, rapid and sustained access throughout Gaza for us to be able to bring the supplies that we truly need, the critical equipment, the spare parts, the education supplies, everything that is lacking here to address the needs of the people on the ground, and also to address these issues from their core and from their root issues. And of course, the funding is very, very important because the ceasefire doesn't mean that the problems have gone away. The ceasefire actually means that a lot of our work has just started now. And we need to continue to scale up this work. And we can do this a lot faster and more effectively, more efficiently, if we had this access that we are asking for, and these constraints and these impediments were removed from our ability to operate.
Okay, well, thank you very much. We really appreciate you taking the time to speak to us. Olga Cherevko, spokesperson for OCHA in Amman. Thank you very much indeed for speaking to us.
Thank you, Tom.